What does amputation mean for pediatric osteosarcoma? Imagine facing a diagnosis of bone cancer in a child and hearing that part of their limb might need to be removed. That's what amputation involves in pediatric osteosarcoma. It means surgically removing the part of the limb affected by the tumor to eliminate the cancer completely. This is usually considered when other options, like limb salvage surgery, aren't safe or effective. The goal is to prevent the cancer from coming back locally or spreading to other parts of the body. Historically, before the 1970s, amputation was the main treatment for osteosarcoma, and survival rates were quite low. But with advances in chemotherapy and surgical techniques, survival has improved a lot. Today, about half of children who have an amputation for osteosarcoma survive long-term. This is similar to the survival rates seen with limb salvage surgery, which tries to keep the limb intact. The decision to amputate depends on factors like the size and location of the tumor, how well it responds to chemotherapy, and whether the cancer has spread. Amputation is usually recommended when the tumor involves critical nerves or blood vessels, making limb salvage impossible or unsafe. In very young children, especially those with large or complex tumors, amputation might be the best option because reconstructing the limb with prosthetics can be more challenging. Losing a limb is a big change for a child. It means adapting to using a prosthetic device and going through physical therapy. While limb salvage surgery aims to preserve function, it can sometimes lead to complications like infections or the need for multiple surgeries. Amputation can avoid some of these issues but requires the child to learn how to move and function with a prosthetic limb. There is some evidence suggesting that children who have an amputation might have a slightly higher risk of dying from the cancer compared to those who have limb salvage. However, this is often because children needing amputation tend to have more aggressive or advanced tumors at diagnosis. It's important to remember that each case is unique, and treatment decisions are made carefully by a team of specialists. Psychologically, amputation can be very challenging for children. It can affect how they see themselves and how they fit in socially. Support from psychologists, counselors, and support groups is vital to help children and their families cope with these emotional and social changes. Long-term care for children who have had an amputation includes regular checkups to monitor for cancer recurrence, ongoing physical therapy, and managing prosthetic devices. Advances in prosthetic technology and rehabilitation have helped many children regain mobility and enjoy active lives after amputation. In summary, amputation in pediatric osteosarcoma is a serious but sometimes necessary step to control the disease. It offers a chance for cure when limb salvage isn't possible, but it also brings significant physical and emotional challenges. Each treatment plan is personalized, balancing the need to remove the cancer safely with the child's overall well-being. Consulting with a multidisciplinary team of healthcare providers is essential to make the best choices for each child's unique situation.